whatever we do, at some point there are failures or there is negligence. So you have to reintervene. So our lives are by themselves a circle of reintervention. There is nothing that I know that is persistent. I cannot have any example of that. Everything has these boundaries, ups and downs. And what you have to do is to know how you treat things at the appropriate time. This is why I think meditation or thinking or these 15 minutes are very helpful to go through all of this.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to the centennial episode of Parallax. To the listenership, thank you so much for tuning in every other Monday to listen to us. And it's been a journey for us, at Radcliffe Cardiology as well as at Parallax to reach the centennial episode. We've had the opportunity and the privilege and the blessing to host some luminary cardiologists on our platform. And our hope has been to touch upon their lives and their careers and to learn from them and to imbibe what they've done so well, balancing their personal life as well as their professional life. And it's emotional for me. It's also incredibly special for me to host the 100th episode and to host it with someone whom I can say this as a field we've all looked up to, we've all aspired to be, and to someone who I do not think needs any introduction whatsoever in the stratosphere and in the universe of cardiovascular medicine and cardiology, or medicine, I should say, at large. So with this preamble, it is my absolute honor and privilege and a blessing to welcome Dr. Valentin Fuster on the centennial episode of Parallax. As I said in the preamble, Dr. Fuster does not require any introduction. He is the editor-in-chief of Journal of the American College of Cardiology. He is a professor of medicine at Mount Sinai School of Medicine. And Dr. Fuster, I'll share this with you. The now inaugural Dr. Valentin Fuster Professor of Medicine, Dr. Deepak Bhatt, was actually the guest on Parallax on our 50th episode. So it is befitting that Dr. Valentin Fuster himself is the guest on the 100th episode. Dr. Fuster, welcome on the show, and thank you so much for doing this for us.
Thank you very much. I'm very proud to be with you and to have a discussion about life.
Absolutely. I can't wait to get started. So, Dr. Fuster, so many of us, obviously know you as who you are, cardiologist extraordinaire. I'd like to start this episode by asking you about, your early years. How did your upbringing in Barcelona, shape up the person you are today?
Well, I think, first of all, my father was a psychiatrist, and I was the last of 5 children. So I evolved with tremendous degree of freedom. I suspect this freedom was controlled, maybe less than in my brothers and sister, but certainly I remember that was fantastic. The feeling free, and at the same time very positive. My mother was an administrator in a hospital, and she was very, very positive. And then I had somehow at that time, I began to think about my grandfather, who was a very interesting individual. Was the president of the University of Barcelona, but he was very socially oriented. So he developed a number of schools, free schools that nobody had to pay anything. And this was across Catalonia in the south of France. So in a way, summarizing, significant degree of freedom, very positive, and somehow socially oriented already from the beginning.
I think that's a great concoction because you mentioned freedom, and there is something to be said about freedom. Would you say, Dr. Fuster, that freedom would also mean lack of fear? Is freedom also fearlessness? Is what I'm trying to ask you.
A good point. Is freedom in the sense of expanding in your curiosity, in your development, in your creativity, but always under some degree of control, not very tangible, but I think was there. Is a sense that you are yourself, but at the same time, you're not going to do stupid things because there's somebody who's going to tell you. And I had this, no question about it. And when I go back, I think this is fascinating to me. And I have to say, what I learned in the early ages of my life, I think has a lot to do with the projects I am carrying out today in terms of children and so forth in promoting health. I think it has a lot to do with that time.
Dr. Fuster, the other facet of your upbringing that you mentioned was positivity, and I think positivity is important to each one of us. I think particularly practicing cardiologists and in every sphere of cardiology, particularly procedural cardiology, as we are interfacing with patients when they're very vulnerable, and it's such a privilege to be in person. How do you foster positivity in 2023? And the reason I ask this is because of somehow the culture we find ourselves in. There is quote unquote a cancel culture. People just want to cancel each other a lot, or so is my perception. How do you foster positivity in 2023?
Very important question, actually. And I think it goes back to another question, which is the question of what do you mean by success? Let me be sure, because this is very important. To me, this sense of positivity comes that you are doing what you are good at. This sense of fulfillment is so important in each of us. And that is, you may be ambitious in trying to do something, you don't have the tools to do it. But if you have, whether are patients, whether it's research, whatever it is, and you say, this is the best of me, let me move forward. There will be failures, there will be successes, but the fact of the matter, the most critical issue is actually this sense of fulfillment. And I say this because many people come to me and say, tell me what is success. And I say, success is fulfillment. Sometimes it works positively, sometimes it works negative. And I think that's what it is. So in a way, I try to convey to you my view of positivity too. And that is, you do the best you can and you accomplish or you try to provide to society the best of you. That to me is critically important. Anyway, I tried to answer your question the best way I could.
Yeah, no, I think that's a fascinating answer, actually, and I will get to success and failure, later in the show. But thank you for signifying the importance of fulfillment. I think that is what gives each one of us, at least I can talk about myself when I'm, here with you, that that is one aspect of one's existence that would give you a good night's sleep. I had a fulfilling day and I did what I could do best to help the people around me, which brings me to the third facet of your upbringing. And you mentioned about the social aspect. Thanks to your grandfather, just an allegory. I was very, very attached to my grandfather, and I think some of the spiritual and religious aspects of my personality and what I've imbibed in my clinical practice is because of my grandfather. How was having a socially fulfilling life impressionable to you? If you can explain that to us. Well,
maybe examples are critical. I wanted to be a tennis player. And actually at age 15, 16, I was the second in Spain. I was subcampion, and then there was the champion in doubles. But I failed on one subject. I don't remember which one it was. And my father said, you cannot play tennis 4 hours a day. You now have to devote time to this. And I did it that summer. I was selected for the Davis Cup of young people in Miami. And they said, you have not played during the summer. You have to play with few people. You will win and so forth. I lost. And that day, which I remember vividly, I reached the conclusion that I was not going to be a Rafael Nadal or anything like that. So I switched, completely stopped tennis, 100%. And then the question was, what do you like to do? And I like nature a lot. I like the biology of nature. I don't have to go into the details. So I decided to actually work or go to the university to be what we call in Spain agriculture engineer, anyway. But at that time, Barcelona didn't have such university for that subject. I had to go to another town. So there was no chance. We used to be with the family where you were born. And in the moment of, I wouldn't call despair, but the moment of saying who you are, like a miracle happened. And there was a mentor, somebody who followed me when I was playing tennis in the same Barcelona tennis club, say, you will be a fantastic physician. I didn't know what he was talking about. And the reason I didn't know is because I say, this person actually was the most known physician in Spain. He wrote the textbook in Spanish and so forth. And somebody of that caliber telling you, I said, fine, I will be a doctor. It's as simple as that. It's the belief on somebody who out of the blue tells you something. Well, that individual developed a heart attack at age 43. And he said, of everything I know, cardiology, I am the weakest. So you must be a cardiologist. And actually, that's exactly what happened. That's the reason. Then he advised me to go to the UK rather than the United States, because in the UK, I could learn the basis of medicine. Interestingly, there's no need to go into this right now, but it's more than technological, was a different type of medicine. And at that time, basic science was histopathology and electron microscopy. So I worked with Professor Sheehan in Liverpool. And Professor Sheehan told me everything I need to know. And I remember after 2 weeks to sit with him in the diagnostic department, he said, what do you see in this slide? And I said, nothing. Then I put it in the microscope. I saw nothing. She says, now you need electron microscopy. This is a clot full of platelets. And I said, what that means? This was a patient who died of a heart attack. And I said, what the heart attack is the cause of the consequence. I'm talking about the early 1960s. And he said, I don't know, very humble guy, which I learned a lot. But you should do the thesis about this in your future. This is what led me to research that slide. But the important thing here of these aspects is what mentorship is all about, is trust on somebody who independently tells you what to do, and you don't have to think about it. It's just as simple as that. So in fact, my life was very simple. It's just to follow people I trusted and people who I knew would do anything for me. Anyway, I'm just trying to explain to you, or at least giving an answer to you. I always felt fulfilled, but people helped me to feel it. And mentorship, I can tell you, is something I am obsessed about it when I talk to young people. Also, older people need mentorship. But we should not forget those early times in life. Who is the one who cares about you, who you trust? Just follow.
Thank you, Dr. Fuster. That's a beautiful answer. And, it was actually a great segue that you brought up mentorship, because that was going to be the next topic of discussion for this podcast. You brought up a crucial aspect of life, which is trust. Which again, in 2023, I find a lot of people struggle with, and I think again, embarking upon examples, I think, trust for me is the ability to listen to that very meek inner voice, which tells you that this is your path. And I want to the fact that we have you on the show, learn from you through your wisdom, how you develop trust in someone, or how you know that this person or this opportunity or this project is worth my trust.
Not difficult to answer. You are listening to you by somebody else. It's as simple as that. And that is, you want to know the truth. You want to be fulfilled. You want to know who you are. And somehow another voice is resounding on you. And that's what it is. In fact, these people I mentioned to you, and I could mention other, Desmond Julian in Edinburgh, who I was his fellow for 3 years. He didn't talk too much, but whatever he talked is myself. He knew me so well. So the trust is something that are you, but is somebody else who is talking for you. And this is a sense that is absolutely important. Many young people, unfortunately, say, I don't trust anybody and I don't need mentors. Well, these people, unfortunately, are too arrogant, I would say. They don't realize that we need help from other people. And that's where trust comes in. We cannot walk alone. And I have to tell you this, frankly, Ankur, when I go back to my life, whatever job I had, whatever, I always think about other people. There's no question about it. The people who help you. And these were people with trust. Let me tell you something. You may be the head of a department, and then you have to recruit people. And maybe people who are fantastic in their knowledge, science, anyway. I have to tell you, the people I have certainly that work with me, there's much more than that. And this is trust. So because it's part of your life. So this goes beyond a personal feeling. This goes beyond. It's the group you develop, the people you develop, and all of us have trust among ourselves. So what I'm saying is the word trust is just resounding something on yourself. And it's extremely important to choose who you trust and who trusts you, because it's a mutual kind of an interaction.
Excellent. And, moving on, I think from trust to, building a unit or building a department, which I'm going to ask you next is how do you overcome barriers, in your excellent book, which I think every physician, I think everyone should read. I certainly have a copy. It's called The Circle of Motivation. For those of you who do not know, Dr. Fuster has published an excellent book. It's called The Circle of Motivation. Go ahead and get yourself a copy. It's available on Amazon, among other platforms. So Dr. Fuster, in Circle of Motivation, you shared your moments that, have shaped you, including your very first day at Mount Sinai. So I want to use that as a platform for this question as to how did you overcome barriers, and how did you, while overcoming barriers, maintain your optimism? Because again, that is something which I believe is a skill. Maintaining optimism, which goes back to your early life of being positive, thanks to your mother. But how would you answer that question for us?
Yeah, the question is, we have good and bad moments. And this may happen on a daily basis, on a monthly basis, on a yearly basis. I think this is absolutely important that you have that sense of ups and downs. And this is actually what I believe. If you do what you are supposed to do and you have a bad moment or a bad time, a bad experience, what you do is you try to overcome that and saying, I am at the bottom, but I know I can be on the top. So whatever affects you, I wouldn't say you have to be optimistic, but you have to be positive. And then you move up into high. And when you are very high, you have to be very, very careful because this is the beginning of going low. So the sense that who you are and you do the best you can, this in itself gives you a motivation, but there is much more than that. I have formulas, doesn't matter, but the one issue that for me has been extremely helpful, is to do nothing 15 minutes a day. I arrive in my office very early. In the first 15 minutes, I look at an idiot. I do nothing, thinking what is wrong, what is right. You don't have any phones, nobody bothers you. And then those 15 minutes of every day to me, I have to tell you, is certainly 75% of the day. You are prepared, you think about it, and always with the same concept. Is your own, your own person. And here I have a formula of 4 T's. One is time to reflect, which is what I mentioned. The other is talent, to become aware what your talent is, which I already mentioned. The third is to transmit positivity, which I already mentioned. And the fourth is tutoring or mentorship, that I already mentioned. So in the lowest times, I really go through all of these and I say, you know what? You're doing the best you can. If you don't, just try. Anyway, that's, to me, is the circle of motivation, to be sure that you understand that what people say, what is happiness? I don't talk about happiness ever. I talk about fulfillment, and I talk about ups and downs, and I talk about positivity, and I talk about what can we give to society if biological, you are already ready for that, because we all go through biology. First is ourselves, and then you may move to society once you fulfill. So more or less, this is the way I can answer your question. And this is the circle of motivation.
No, it's a profound answer, and thank you for answering it so eloquently for us and so beautifully for us. Which brings me to my next question, and I know you touched upon success being fulfillment. I'm going to back up a little bit and ask you if you judge your life by successes and failures, because my next question was going to be, what is failure? And if that is the right ideology, or if that's not the right ideology, what is? How do you judge different moments in your life, when it comes to successes and failures?
Yeah, interesting question, because I mentioned success and failure, and I don't think are the right words, because you are constantly in that circle. It's not a judge. Failure is you don't get what you expected. For example, in science, you write a fantastic paper, you think, and it's turned down or even not reviewed, and that's, well, the only thing you can say is I did the best I could to write that paper. It can be in your own family, in your own relationship, wife or husbands and so forth, and something goes wrong. Well, in life we have to review things and to go into this circle of motivation. In fact, I will tell you an anecdote. We are working at this moment with how we teach health in very young age, between age 3 to 7. And what we have learned, interestingly, whatever you do at that age, you capture and then comes up later on. But one thing is you have to be recurrent of your intervention. You can do an intervention between age 3 and 6. For example, 60 hours of teaching the importance of health and so forth. But you have to reintervene at age 12 and at age 20. And what is interesting here is in adults is the same thing. And that is, whatever we do, at some point there are failures or there is negligence. So you have to reintervene. So our lives are by themselves a circle of reintervention. There is nothing that I know that is persistent. I cannot have any example of that. Everything has these boundaries, ups and downs. And what you have to do is to know how you treat things at the appropriate time. This is why I think meditation or thinking or these 15 minutes are very helpful to go through all of this. Anyway, I don't know if I answered your question, but certainly I don't call success or failure. It's just our lives are constantly a fluctuation, like a volume pressure curve, you see. And that's how it is.
Yeah, no, and I think a good analogy here, from my own practice of meditation, from my own practice of transcendental meditation in Buddhism, they teach you is that there is never stability, and that there is always, that change is the only constant. And you find stability, you basically relax into stability between two peaks of instability, which is the trough, and then you are ready for another instability. And that's what you do, is you oscillate between peaks and troughs. And you have to learn to relax into stability while being ever prepared for another wave coming, which is, sort of exactly what you said when you were talking about volume graphs.
Yeah, I agree completely to what you say.
Yeah, no, thank you.
And I know Buddhism also, but I know Christianism and I know Judaism. It has been interest I have had. But anyway, this is a different subject.
Yeah, no. Thanks, Dr. Fuster. So I want to talk to you about leadership, because I know that there has been, interest. Certainly JACC publishes a leadership page, and I think in the broader physician community has been an interest to quote unquote develop physician leaders. I'm sure you could train. I mean, it's all a skill, but I wanted to get your opinion on quote unquote born leaders versus, leaders who are trained. I don't even know if leaders can be trained. I think the physician in and of itself, I think the occupation of being a physician is a leadership role. And that's how I see, being a physician as, certainly. But, to you, what served you as your driving force and as an inspiration to be a leader and a researcher?
It's an interesting question, because I had jobs that I never pursued. And I said, how did you get that job? And if I go over things you have done dealing with groups of society in which you are up there and you're supposed to, I think the first thing is to be humble. Leaders who are not humble, they don't last too long today. That's number one. Second, I think example. You cannot talk and say things when you are not really an example of what you do. And the example comes from what you and I have been talking, in the last few minutes about fulfillment, to do what you are doing right and so forth. And one issue in being humble is, if you get a job of leadership, be sure you enter from the back door, never from the front door. Be sure you don't talk too much, but you do. In other words, and it's yourself. So I found myself in positions, you said you are the editor of JACC. Well, if I had to tell you why I'm the editor of JACC, you might laugh. It was I never looked for being an editor of JACC or to be president of a society. I never. But what happened is the fellows came to me the day of the deadline, 2 days before the deadline, of editor of JACC, and they say, you have to edit JACC, you have to go to the young people, you have to do this, you have to do that. I listened to them, and certainly I apply, but I don't know, and it has been a very fascinating experience, because how you develop issues like the central figure, how you go into podcast of all the articles, and so forth. You put yourself into some side of first in a humble way, and then you try to help the outside. So I think leadership is a combination, in my view, of humility, example on one hand, and then you want to do something good for society, whatever you are doing, or groups of people, whatever. You try to do something good for them. To me, this is the balance that tells about leadership.
Yeah, what a beautiful answer. It's just as beautiful as poetry. And, I think it is a great segue for me to, ask you about being the editor-in-chief of JACC. a lot of firsts. And, I think as a reader of JACC and as someone who's followed the journey of JACC, obviously as an author, as well as a reviewer, I've served in several roles, and I'm really grateful for all the opportunities. The Valentin Fuster era of JACC, in my mind as a reader, would be Central Illustration, would be the podcast, would be the clean, uncluttered, white JACC front cover, would be the Fellows in Training and Early Career page, which I've written a lot on. And thanks for, being so receptive to my ideas as a Fellow in Training and as Early Career. And also the leadership page. I think those are the four big standouts for me. I'm sure a lot has gone into the editorial process and how you select articles. Also the review topic of the week, which is fantastic. So, and I've enumerated so many already. So, which tells you that you've clearly, stolen the hearts of so many of us.
Thank you very much. But I feel very humble. I want to tell you this. Look, all these things, I enjoy doing it. Is something I can do. I feel I can do it. I feel I'm not out in the woods. And I feel happy doing it. An example is about the podcast. A podcast, what it takes to do all the podcasts of all the articles. I can tell you 19 hours a week, 19. Why? You have to read it. You have to be sure you don't fool people on anything and so forth. And you say, do you enjoy? My wife constantly asks me, how can you work on Saturdays using almost all day on this? Are you enjoying it? And I said, yes, I do, but be sure that we have time for us on Sunday or the rest of the week. So in a way, you have to do what you like. And you find yourself that whatever you do, you may do it correctly well, because that's basically, I would do things. If you ask me to be an interventionalist and to go to your place and just look, I am not that guy. I can tell you, I don't have those hands. I don't. And I will never get there. Although I was encouraged to do something like that, no, I will never do well. It's like playing tennis. It was fine. So I think you have to enjoy what you do. And JACC, whatever I'm doing, I enjoy, and certainly it takes a lot of hours, but I must tell you, I enjoy if I can do something that helps somebody.
Yeah, no, I think certainly helped, helped so many physicians take better care of patients at the bedside. I think the one aspect of JACC which I would never miss. I would try not to miss all the original research that's published, but certainly the review topic of the week is very friendly for a physician who's at the trenches taking care of patients at the bedside. Would never miss a fellow in career early training page, fellow in training early career page. Would never miss the leadership page, which talks so much about how our society is evolving. I think I forgot to mention one more aspect, which I think was very novel, remains very novel. And that is how cardiologists and scientists and us as clinicians interact with society. I think cardiovascular medicine and society is such a beautiful addition to the journal, thanks to you. Which brings me to my next question. And that is, what does leadership mean to you in the context of global health or public health?
Well, I think here is a little bit the background that I mentioned at the beginning, and that is what can you do for society? And here you have to be very humble. And that is first, not to talk too much and try to do. And frankly, I am very involved at this time. At this time, what I decided to do 10 years ago, maybe some existential crisis, I said, we are treating disease too late. Why we don't understand health better? And maybe at the scientific basis, molecular, cellular, and so forth, and maybe we will find ways to prevent disease pharmacologically or otherwise. And I move into the field of promoting health. And now at the present time, we are working with children because I think this is the age that they capture everything and maybe later on it comes out. I mean, when you look at yourself or myself, it's so important, the environment that we live at early stages of our life. So we are dealing now with 50,000 children around the world, and it's a very engaged process of trying to understand how we can make a priority in these children about health. Middle age, I would say middle age, but between age 20, 30 to age 65, we are working in understanding imaging with the ultrasound who has subclinical disease. And we are learning a lot about it. All the guidelines don't take into account when there is subclinical disease, because you do it when you catheterize patients, but not when you have simple technology. In this case, ultrasound of the carotid, iliofemoral, and so forth. We're very involved there in a huge study, 12,000 people, and it's fascinating. And then in the elderly, we are getting into the brain with new imaging technology. And one of the things we are learning is that whatever happens in early life with your risk factors get into the brain in later life. And we do this with imaging, with MRI quantification, PET, and so forth. Hypertension not being treated, diabetes, hypercholesterolemia, and so forth. So these are three large projects that really are dealing with health, but trying to do things before you get into disease. And, I learned so much about it. For example, all these new treatments of heart failure, you are enhancing defense mechanisms, the new pharmacological treatments. The vaccination, I had the luxury to be together in an award presentation with those who developed the vaccine. We became very good friends. And actually, it was very interesting. The mRNAs that we thought were a manifestation of disease, they were defense mechanisms. And the vaccine is how you enhance these defense mechanisms. We find the same thing with the bone marrow now, with the macrophages. But what I'm saying to you is that at least my process at this moment of fulfillment is to really get into the same thing we did with disease, but now trying to understand health and how can you have in society, even if it is an inch, because that's basically our contribution, and that's what it is. And so I'm very excited about this time, despite of anything, age and so forth. I don't care much if you can continue to develop what you can do reasonably well. So basically, this is what I'm doing at the present time, and I'm excited about it.
Thank you. It's beautiful. Excellent. Thank you. So talking about the future, Dr. Fuster, how do you select your priorities? I mean, I'll give you an example. I mean, I think we've been trying to facilitate this centennial episode for months now, and with the understanding of how busy you are, and just to give the listenership an example of this is that you're on vacation now. So thank you so much for doing this for us while you're on vacation. This is incredible for me. But in terms of selecting priorities, because I'm sure you get pulled in so many different directions. How do you do that? Moment to moment. How do you go about that?
The 15 minutes in the morning, you probably are going to laugh about it, but life is a priority. Look, when I come in the morning, I have to do lots of things, and I have today 20. Well, I will end up doing 6, most likely. And in terms of projects, you might have 5. You will end up doing 2. But this is something that is intuitive, is the curiosity, is what you are capable to do. And this whole concept really goes to many of the issues we discussed today. And that is, sure, you would like to do 1, 2, 3, 4, 5, 6, but are you capable to do that? And one of the issues I have learned is the issue of trust that we mentioned before. I work with a team of people. For example, the projects in health, we are probably 50 people working on. And, it's the trust. And these people that go back many years. And some are related to children, some middle-aged, some in the elderly. But basically, this is the sense that you have. You are enjoying what you are doing because you're working with people and you prioritize properly. I think the priority system is who you are, what is feasible, and let me do it the best I can. And then you set up your priorities. It seems very simple what I tell you, certainly it's complicated, but the process by which you reach that goal, which is priority, I don't think it's too complicated. I mentioned, look, 10 years ago, I was working with disease. And one day I said, God, we are not preventing it. But then it moved me into health, which is much deeper than preventing disease. It's how you mobilize all the aspects that you learn at the molecular, cellular level and so forth, and you begin to work with health. So these priorities come to you, I think, by intuition, by curiosity, by thinking, and so forth. And then you say, well, this is feasible. Let's move on.
Dr. Fuster, you've touched upon again, it's a word which I think more physicians, well, at least that's my perception, is that more physicians need to tune into more, and that is intuition. And I find, certainly my father, who's a very intuitive physician, and he certainly has been my role model, in clinical medicine. How do you harness intuition? How do you fine-tune intuition? Because I think that is so important to each of us as humans, not only as physicians, but also as humans.
I think it's not only you, it's part of the other people who you work with and you trust. And this is actually, we went from the very beginning in the discussion here today, is that intuition comes with the others. Why Professor Sheehan, with that slide, told me that I should get into what is the cause of heart attacks, or that cause of consequence. But somehow he learned from me something, which was that curiosity into understanding heart attacks. And I think he pulled it together and gave me a message. And I think this happens with anything. I think intuition comes with the relationship with many people. For example, I work with, this program, Sesame Street. Sesame Street is an educational program in children. Well, they've recruited me. I don't know why, but anyway. And we changed Cookie Monster from eating cookies 7 days a week to 1 day a week. Why? I thought that was wrong to give to children that message. So we began to eat 1 day a week, and this had a tremendous impact on children, to the point that Sesame Street today is all about health in developing countries, HIV, Chagas disease, malaria. That's what Sesame Street changed. What was the intuition? The intuition was, I don't know, I got into that program, and I say education of children is so important, and my life was so critical. How you can have, being a physician, a guy like Cookie Monster eating cookies 7 days a week? I don't know whether it's intuition or what it is, but it's the whole system shakes you up, and you change, or you try to change the system. And now you might know what is interesting, he's a doctor now, it's myself, he's a Muppet, Dr. Rooster. And actually has an incredible impact on these children. He's now in Latin America and he's coming to the United States. Something that processes that show how the Muppets deal with health, how Cookie Monster does a resuscitation to another Muppet. But all of this is intuitive, but it's the way you deal with things and so forth. Don't ask me how I got into Sesame Street. I even don't remember that. But it's the whole context. It gives you a sense, this is what I can do, and I think it's worth it. So intuitive is you and the other people.
Yeah, no, excellent. Thank you for that. Dr. Fuster, I'm sure you've come across this as the editor-in-chief of JACC, and as a clinician scientist. What do you think about artificial intelligence? Some would like to call it augmented intelligence, which I think is a better word than artificial intelligence. And how do you see it interface with medicine? How do you see the next 10 years with medicine and its interface with AI?
Look, it's interesting because I have an editorial about this week, actually, in JACC. This is the way I see it. First of all, I think I understand what artificial intelligence is, and there are positives and negatives. The positives are obvious. They will be able to pull together facts that our intelligence is not capable to. But I'd rather like to talk about the concerns in terms of medicine. The first concern I have is today in education of the young people is very digital and technologically oriented. They present a patient to me and everything is data. When I said, when you talk to the patient, is the patient dizzy? Did you do orthostatism? Did you look at, you understand? It's like something in the educational system that is bothering. And artificial intelligence, in my view, is going to enhance this further. So what I'm saying to you is going to be very helpful in pulling data together, but in a way, I am very concerned into what consider digital versus cognitive pathways. And the cognitive pathway, in my view, is going to be affected. Then, being in JACC, I have experiences already with the ChatGPT that are not good. Articles that come, you don't know where they come from, the data. Is the data manufactured? Is the data real? So today you can write a paper which appears to be beautiful, and you don't know where it comes from. So even the journals in the future are going to be incredible challenge of how you judge a paper that comes from artificial intelligence and otherwise. So I think artificial intelligence is very interesting. For example, I read this book, and I know both of them, Smith and Kissinger. And they wrote a book about artificial intelligence. And this is very fascinating because I tell you, the future out of medicine, you will be able to predict if a confrontation that evolves going to the past, what is going to happen. And the question is, the politicians are going to follow what artificial intelligence tell you not to do, or they are going to follow their own ambitions. So artificial intelligence has many good things, and this is a good one. In that case, is it going to be followed? You see, it's a completely ball game. So I think we are dealing with, to me, it's like the discovery of electricity. We are going to be dealing with something very serious here. And the question is how you dominate what we have in front of us. And this is a huge challenge. I only mentioned to you in medicine what my concerns are. I'm concerned about the journals, and I'm concerned about the cognitive versus the technological development of the young people. I really do, because this is a problem we face today already.
I'm on board with you. I haven't had a chance to read your editorial, which I will, and we'll try and share the editorial in the show notes.
Yeah, I mentioned that. Yeah.
We'll share it with the listenership in the show notes for the podcast. And this has been a fascinating discussion, Dr. Fuster. Thank you so much for your time. I want to, as closing remarks, 3 books that you would recommend to the listenership and Parallax, and what will be your final advice to our listenership, particularly early career faculty?
Well, first, let me tell you what I read and why.
Mm-hmm.
I read very much conceptually and philosophically. You have to understand that when you feel you are obliged to do something for society, you really choose what you read. And it's interesting to me. I was very influenced by Rabindranath Tagore. I was very influenced by the French philosophers, Teilhard de Chardin. This is inside me. This is conceptually. In terms of science, aside of medicine, I read every week Nature and Science on issues that are not necessarily related to medicine. Meantime, I read books that you can say, this book really had an influence on you. Well, Daniel Kahneman is a Nobel laureate. He's a good friend of mine. He was an economist and psychologist. And he wrote this book, Fast and Slow Thinking, and most recently Noise, which is fascinating. I am very touched by Viktor Frankl when he wrote The Holocaust. In the worst circumstances, what positives you can learn. We have been talking about this afternoon about this. Barbara McKenzie has a very similar book called The War. What do you learn from wars that is not a disaster? What do you come out with positive? So these books have a tremendous influence on me. What can you get of positive of a bad experience? And how can you be logical in a world that is illogical? And this is actually Daniel Kahneman with fast thinking, slow thinking, which is a lot about intuition there. When you use the logic, you probably don't get anywhere. When you use your intuition, probably you do. And that's the book. So I would like to have more time, but this is exactly how I move. And I have a tremendous driving, I have to tell you frankly, with Christianism in terms of the role in society. How much I learned from Buddhism and how much I learned from Judaism. So, but I think this driving to, can you do something for society, to me is absolutely critical. And I think we evolve biologically. At the beginning is how you survive. That's the reality. But as you advance in time and you feel more secure or more stable, I would say, into what you expect, I think is the time that you can begin to move into what can you do for somebody else. And I think I am certainly at this stage, I am age 80 right now. I feel very energetic. With my bicycle, I do all what people think is crazy. But, if you have the possibilities, why not? And so I think very much in terms of reading is very much involved into with all this reading, can you do something that is meaningful? That's basically the stage I am, which is different stage than when I was age 25 or age 30, where, what do you do that will make you to move forward and so forth? You don't think about society at that time. You think about yourself. So I think this change in biology is very important.
Yeah, no, those were excellent books. I've read Thinking Fast and Slow by Daniel Kahneman, and I'm gonna make sure I read the other recommendations from you. Thank you for sharing with us such a philosophical and spiritual side of you. It's it's inspirational, and may the force be with you. You are a fantastic 80-year-old. I wish all of us are as good as you are at 80 and as productive and as forward thinking and as progressive, as positive. Those are all excellent qualities to look up to, Dr. Fuster. Any closing remarks for podcasting in general, as well as for Parallax? And I hope you get to other episodes.
No, the only question, the only issue I would say, it has been a pleasure to be with you in the last 45 minutes. Why? Because you touch into the critical issues to me. And again, here's where the intuition comes. I don't know you well enough, but I think I do now. And I think this is the kind of interview that to me is much more meaningful than just going into what people call accomplishments or what this kind of thing. So I have to give you thanks. And this is the only message I can give to people. And that is, if they listen to the interview, I think they are listening to two people that they think alike. And again, this is intuitive.
Oh, this is such a beautiful closing remark, Dr. Fuster. Thank you so much for doing this for us. And I hope this is widely listened to, because I've learned so much from you as an individual, as a person, as a physician, as a scientist, and really as the editor-in-chief extraordinaire who's broken so much new ground with JACC and continues to do so in his life with public health and with how we think of children. Thanks again. This has meant so much to me, and this has been a very spiritual experience for me also. So thank you for that.
Well, thank you very much for this opportunity. I hope we have more of a chance to talk and so forth. But it's a pleasure. It has been a pleasure. Thank you very much. And I appreciate it. Thank you.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.